Have you ever wondered what your stool might look like if you have colon cancer? This might not be your usual dinner table conversation, but it's an important one nonetheless. Colon cancer, a prevalent and often silent disease, sneaks up on many individuals, affecting hundreds of thousands worldwide. Early detection is key in combating this disease, and surprisingly, your stool can be a vital clue in this detective work. Stool, often overlooked as an unpleasant byproduct of digestion, can actually reveal a wealth of information about our health. When it comes to colon cancer, changes in bowel movement and the appearance of your stool can provide early warning signs. It's not about becoming obsessed with your bathroom habits, but rather being aware and informed about what's normal and what's not. Understanding the changes in your stool can be the first step in early detection and treatment of colon cancer. So let's dive in and shed some light on this often taboo topic. Knowledge is power, after all. Before we delve into what stool might look like with colon cancer, let's first understand what normal stool looks like. Normal stool typically has a soft but firm consistency, akin to dough. It's usually brown in color due to a pigment called bilirubin, which is produced when red blood cells break down. The shape of healthy stool can vary, but it's commonly described as looking like a sausage or a snake. It should be around 1 to 2 inches in diameter and about the length of your pinky finger. However, it's important to remember that these characteristics can change depending on various factors. For instance, your diet plays a significant role. Eating different types of food can affect the color, size, shape, and consistency of your stool. Other factors such as hydration levels and physical activity can also influence how your stool looks. Now that we have a baseline understanding of what normal stool should look like, we can better identify potential changes that might indicate colon cancer. So, what might your stool look like if you have colon cancer? You might be wondering. There can be several changes in the stool that might indicate colon cancer. One of the most noticeable and alarming changes is the presence of blood in the stool. This might manifest as bright red blood or as a darker, almost black color due to digested blood. However, not all blood in the stool is visible to the naked eye. In some cases, the blood might only be detectable through a fecal occult blood test, a laboratory test used to check stool samples for hidden blood. Changes in the color of the stool can also be a potential indicator. While stool color can vary widely from person to person and day to day, a consistent change, such as persistently pale or yellowish stool, may be a cause for concern. Next, let's delve into consistency and frequency. If you've noticed a persistent change in the consistency of your stool, such as loose or watery stools, or a change in your bowel habits, such as going more often than usual, it might be a symptom of colon cancer. Similarly, constipation that doesn't go away can also be a sign. Another subtle change can be the presence of mucus in the stool. While it's normal to see a small amount of mucus in your stool, a noticeable increase could be a sign of a problem. These changes might be subtle and not always consistent. The symptoms can come and go, and they might even seem to improve before they get worse. It's also important to remember that these symptoms are not exclusive to colon cancer. Other conditions like gastrointestinal infections or hemorrhoids can also cause these changes. While these changes might indicate colon cancer, they can also be caused by other conditions. Therefore, it's important to seek medical advice if you notice any changes in your stool. Changes in stool are not the only symptoms of colon cancer. There are other signs that you should be aware of. Let's delve into these symptoms to better understand the full picture. Abdominal pain is one such symptom. It might feel like a persistent cramp or a dull ache that doesn't seem to go away. This discomfort is due to the cancerous growth pressing against your abdominal wall and surrounding organs. Next, unexplained weight loss. If you're losing pounds without making any changes to your diet or exercise routine, it could be a sign that your body is fighting off something more serious than a simple bug. This happens because cancer cells use up a lot of the body's energy, and the immune system also burns energy as it works hard to fight off the disease. Fatigue is another symptom, and it's more than just feeling a bit tired. It's an overwhelming sense of exhaustion that doesn't get better with rest. This might be due to the cancer itself, or a side effect of the energy your body is using to try to combat the disease. Lastly, changes in bowel habits. This could mean diarrhea, constipation, or a change in the consistency of your stool that lasts longer than 4 weeks. Again, this is because the tumor can affect how your large intestine functions. Remember, These symptoms might be vague and easily confused with other conditions. They don't necessarily mean you have colon cancer, but they should not be ignored. If you experience any of these symptoms, especially if they persist, it's important to seek medical advice. Early detection is key in the treatment of colon cancer, so it's important to pay attention to any changes in your body. We've taken a deep dive into how your stool might appear if you have colon cancer compared to a normal stool. Remember, a consistent change to thin ribbon-like stools or stools that are tarry and dark could be a sign of colon cancer. This isn't a cause for immediate panic, but it's definitely a signal that you should consult a medical professional. Along with changes in your stool, we discussed other symptoms to be aware of, like unexplained weight loss, constant fatigue, and persistent abdominal discomfort. We cannot stress enough how crucial it is to keep an eye on these signs and reach out to a healthcare provider if you notice anything unusual. Even if it's not colon cancer, it's always better to rule out any health concerns. We're all about promoting proactive health awareness and keeping our community informed and healthy. Our bodies are complex, and sometimes they send us subtle signals when things aren't right. It's up to us to listen and respond. And remember, early detection can dramatically increase the chances of successful treatment. If you find this tip helpful and want to see more like it, hit that subscribe button and click the notification button for more videos. Also, don't forget to like, share, and comments below with your thoughts. Stay healthy.